When a patient's referred to a radiation oncologist, that initial consultation happens, and if radiotherapy is an appropriate treatment and consented to with the patient, then the first step is generally what we call a radiotherapy planning and simulation appointment, where the patient comes in and we essentially take measurements and a scan of the area to be treated. We then, over the next week or so, work out how we're going to give that treatment using our planning software, which is essentially mapping out how the radiation therapy machine will behave to provide the radiation therapy to the patient. Once we've got that organized, we bring the patient back for their treatments. And the treatments themselves can vary between short treatments, sort of 10 treatments long, up to 25 to 30 treatments, really depending on this clinical circumstance. That's the practicality that the patient might see. So in the consultation, we always talk to the patient about the relative time commitment, because radiotherapy is generally a repetitive treatment, whether you use a short or a long protocol. And the patients need to understand how they might do that if it's a daily protocol. If we talk about why we might choose one protocol or one treatment timeline versus another, it's essentially a balance between effectiveness and toxicity. If you use a treatment protocol that is short, every day you give a higher dose to get the radiotherapy in, that can lead to more acute or late side effects. Now that may not be as big a deal in an elderly person if it's not in a cosmetically sensitive area, and we do the treatment conveniently and quickly. In areas that are more sensitive cosmetically, if you think of the head and neck area, the face, you want to get good cosmetic outcomes, and that's why you make the treatment longer but gentler, and you get less late side effects. So those late side effects in particular tend to focus around pigment changes, fibrosis, and telangiectasia, which is the appearance of capillaries. And you can minimize all that if your treatment is gentler over a longer period of time. So some of those medical aspects get balanced out with the patient's wishes, practicalities, and logistics.